Welcome to Deuk Spine Institute. We are now getting ready to do our third surgery for today. This patient comes to us from Palm Beach. Now, he's had back surgery before. Henry, show the audience his x-ray image.
Copy that.
Tell me when it's up.
Oh, we're up.
All right, go ahead, Jordan. Put your arrow on there. Folks, you see, this patient's had the double whammy fusion from the front, the back, sideways, every which way, L4-5, L5-S1. Jordan's going to show you the screws. Can you see the white arrow, Henry?
Yes, we can.
All right, go to L4. He's got two screws at L4. Go up one. Those. Two screws at L4, about $1,000 a piece. Two screws at L5, another $1,000 a piece. Two screws at S1, $1,000 a piece. You got the set screws, huh? Oh, more than 1,000. All right, sorry, it's about 2,000 a piece, so that's 8,000 bucks. And then you got the rods, which are about 1,000 a piece, maybe 2,000 a piece because they're percutaneous. So now we're up at what, 8, 9, 10, 11, 12 grand. Then we got those cages. Show us the cages that were put in. Those cages are 5,000 bucks to 10,000 bucks a piece. We'll just say conservatively 5,000. That's 10 grand. So far we're up at $22,000 in implants. Now we got these screws. Look at all these screws in the front of the spine, put in through his belly. Oh man, each of those has got to be around 2,000, right, Luis? 2, 4, 6, 8, 10. So 10, yeah, another 10 grand. So we're up at $32,000 in screws and rods. Now that's a conservative estimate, folks. That would be like me pricing out a Mercedes-Benz and saying it's 25,000 bucks because it's used, but it may be more. Point is, minimum $32,000, somewhere between 30 to 50 grand in implants. Why do you think these surgeons are recommending fusions? They're making $15,000 on the surgery. The company's making $32,000 to $50,000 on the screws and rods. The hospitals are making a couple of $100,000. Folks, it's a racket. And now here he is having the real surgery that's actually going to help him. So even after all that fusion and metal and front, back, going through the belly, going through the back, all that jazz, here he is having the Deuk laser disc repair. Sad. I'm trying to teach people, stay away from these spine surgeons that recommend laminectomy, microdiscectomy, fusions, artificial disc. It's a racket. We're going to get started. It just gets my blood pressure up. All right, a little bit of stick and burn. That's just numbing medicine going in. Now, because he's had all this surgery, he woke up from the surgery. He told me he was no better. He was the same. Why? Because they never fixed the problem. They fused two discs, front, back. They made a lot of money. He suffered a lot. And now here he is coming to another surgeon for another surgery. Why? Because he's suffering. He's still in pain. His problem is actually above. Shot. So we're going to fix the real problem, which is the L2-3-3-4 discs at this point. All right, feel free to ask questions. I'm going to operate. I'm just disgusted with the surgeons that did this. And I'm disgusted with the system and how broken it is, that it's doing all these highly invasive, highly expensive surgeries that people are making a gazillion dollars off of, and patients are suffering as a result. All right. Shot. I'm just doing a little numbing medicine just to get him more comfortable. Lay still. I'm giving you some numbing medicine, that's all. Nice man. Feel bad for him, having his surgery that he didn't need done. Shot. But unfortunately, he found out about our surgery a little too late. Shot. Just lay still. Now, our patients are awake for the first part of the surgery. I need their help. I have to get around the nerves. And nerves are delicate little structures. So I need his help. AP, you can see I'm heading for the first disc herniation at L3-4. That's right above the L4 vertebral body. The L4 body has those two screws in it from the back. Look at all that hardware. Look at that, folks. Yeah, back to a lateral. Just Jordan, show us all this stuff here. You've got screws and rods in the back. You've got screws and cages in the front, plates, mini plates in the front. I mean, I don't think you could squeeze any more hardware in there. Otherwise, they would have done that. They would have milked them for a few more $1,000. When are people going to learn, huh, Henry?
I'll say.
No, it's just unbelievable. Shot. Lay still. All right. You're doing great. Shot. You're doing really good. Shot. Yeah. All right. We're there for the first one. Shot. Right up against the back of the bone. Lay still. You're doing great. Everything's okay. Shot. Any questions, Henry?
No current questions.
Shot. Trying to get in the disc, and I'm literally on the back of the end plate of superior end plate of L4, just sitting there banging on it. I'm just trying to slide gracefully past it, but that's just not going to happen. So I'm going to have to come back just a little. Shot. Nah, I'm almost there. I'm going to just get past this. Looks like I'm going to have to just try, come back a little bit and try again. Shot. Try to go a little bit higher this time, just a micron higher. There we go. See, now I'm in. That's all it took. Just a slight repositioning. All right, here we go. Just lay still. He's sleepy, and our anesthesiologist, Dr. Berndes, has got him getting comfortable. We've already put some numbing medicine. Here we go. Shot. I've got to get to the next bad disc, which is the one above. It's L2-3. Shot. You guys see that?
Yes,
Yeah.
we do.
So, folks, I'm sorry, but I'm going to keep complaining about it till people realize I just can't sit here silently watching people have these horribly invasive surgeries that are enriching their surgeon and hospital and the companies that are basically bribing the surgeons to put their implants in. Shot? And there's so many surgeons out there. The surgeons, folks, aren't going to listen, okay? They're not going to fix their behavior. A rapist will not stop raping. You got to lock them away. A child molester is not going to stop child molesting. These surgeons that are in love with themselves, putting hardware in patients and making a gazillion dollars, are not going to stop doing it. Okay? When I have a patient who has a problem that I can't fix it the best way possible, I send them to somebody who can. It's called a referral. So spine surgeons should be referring these patients rather than sticking screws and rods, cages, and going in the back, going in the front, putting this patient at huge risk of complications. They should be sending the patients to a doctor who can do this surgery. Shot? Anyway, I feel very passionately about it. I really do. I'm just so over it. Shot? All right. We're just about ready for him to be awake. He's going to help us. After all, he's the one who has all the pain, right? So I can feel him tightening up. I'm ready for him, Dr. B, whenever you are.
How you doing, my friend? You all right? How are you?
Let me show you what's happening. So he's got all this screws, rods,
You feeling all right?
metal plates in the front and the back.
I'm gonna ask you some questions now, all right? You can't move your
At
arms.
L4,
stay
5,
still.
and S1.
You're doing
But
great.
he's got a problem above with the disc and the facets. That's L2-3 and L3-4. That's what we're here to fix. Are you comfy?
How you doing?
I'd like to
Alright.
test the discs to see how
I'm gonna ask you a
painful they
question,
are.
all right?
By the way, when we're done, the part
Raise
we're
your left
operating
finger.
on, it will not look like the part at the bottom. What a picture there, Henry, huh?
Unbelievable.
None of that hardware is necessary. The fusion's not necessary. The screws and rods aren't necessary. It's just literally using the patient like a farm animal for milk or eggs. Instead of milk and eggs, you're getting $500,000 off their insurance company. All right. You comfy?
Try to keep your arm still.
Shot? Well, I'm not going to be able to. We're just going to put him back to sleep if he's not ready to go. Yeah, look at those tears. We're good. Let's just go ahead and put him back. We're not going to sit here and wait. Shot? Got to move on with the show. Shot? At this point, we're removing his spinal needle. It's served its purpose. We're now placing the guide wire. And I'm going to use this guide wire to get down to the tear. See that tip right there, Henry? That's called a tapered tip. That's going to gently spread apart muscles, fascia, and then we're going to enter the herniation. And we're going to go in and clean out that tear where the herniation came out of. Meanwhile, I'm going to load him up with some more numbing medicine so he's more comfortable. That way our anesthesiologist doesn't have to give him so much drugs. Shot? All right, now look at the tip of that dilator. It's right at the back where the tear is. You guys see the tear?
Yes, we do.
Show us the tear, Jordan. Jordan will show you the tear. There it is. We're going to go right through that tear right now. Watch the dilator. There it is. You see that? Big tear. Now we're going to go fix the tear. So we've gotten through the tear, pushed the herniation back in the disc. We're going to put the tube down. We're going to take the dilator out, and I'll have now a pathway right to the tear and the herniation. And I can use the endoscope to see it, and I'll use the laser to fix it. Pretty simple stuff. No metal, no screws. This surgery takes the place of all fusions, artificial discs. You don't need that junk anymore. This surgery takes the place of laminectomy, discectomy. We had literally 99.6% elimination of back pain from a disc injury that is these other doctors are recommending fusion for. Fusion can't get rid of 99.6% of the pain, but we can. We looked at our fusion results years ago. We got rid of about 80%, and we have really good results. I have the best fusion results probably in the world with lumbar fusion, transforaminal lumbar antibody fusion. And we had in the 80s, I think it was like 82 or 85%. Look up my paper on PubMed that I published. I don't remember the exact number. It was like, I want to say it was 12 years ago, 10 years ago, something like that. Fusion surgery does not have as good outcomes as this surgery here, not even close. And with fusions, you're usually laid up in the hospital for a few days or a few weeks, and you're on painkillers for months, if not years. All right, any questions from our audience?
No current questions, but we do have a comment from Sherry on Facebook.
Yeah.
They said, wow, he looks like he has sheet metal screws in his back. Looks like he went to a building contractor.
Tell me about it, right? And the thing about it is that if I did his fusion, I would just have the 2 cages, the 6 screws, and the 2 rods. That's it. That's all he needs. So why did the surgeons expose him to more risk by going through the belly? I'll tell you why. Greed, money. You get paid for 2 separate surgeries, basically, when you go through the front and the back. You're making 2 incisions, you get double the money. And you get to put in twice as many screws. So it's all about greed. That's the only reason they're doing it. They'll tell you better outcomes. Bullshit. There's no better outcomes. Not even close. The outcomes are worse. The most dangerous surgery you can do for degenerative disc disease in the lumbar spine is go through the belly. And that's what they did with him. So he's going to probably watch this surgery later today or tomorrow, and he's going to hear everything I'm saying, which I hate. You know, he's a smart man, and I'm always honest with people. I always tell him the truth. I got nothing. I got no dog in this fight. You know what I mean? I'm not the one getting back surgery. You guys are. So I just want you guys to know the truth. It's disgusting to me that these surgeons will not stop doing these surgeries on people because of greed. It pays their bills, and they know about the endoscopic surgery we do, but they don't recommend it because they're not making as much money. Look at the tear right there. That's it. That's all we got to do is clean this tear with the laser, and you get rid of the patient's back pain permanently. It's so easy to do. I could teach other doctors to do it, but they don't come. They don't want to learn. They want to keep doing fusions. That pays the bill. Pays a lot more money. It's all about money. It's not about the patients. That's what bothers me the most. Fine, you want to make it all about the money? Fine, but just tell the patients the truth. Listen, I'm going to recommend a surgery where I go in your belly. I'm going to dissect down to your spine. You could lose your leg. You could lose your kidneys. Right? That's all possible. But you know what? I get more money if I do that. And I'm going to make an extra, $8,000 by doing it that way. Just be honest with the patient. Tell them the truth. Then I don't have a problem with it. Okay? It's the dishonesty that bothers me. If people are stupid enough, if their surgeon says, look, you can go to Deuk Spine and get laser surgery and be out of there in an hour, and it's safer, or you can come have a double fusion with me through your belly and your back, and I can make a lot more money doing it that way, and that's why I'm doing it, by the way. But you still want to go to that surgeon? Well, then you're stupid, and you should go to that surgeon. But people need to be honest to the patients, I realize there's patients out there that you can be completely honest with them and they'll still choose the wrong thing. That's fine. But as long as they know and they have a chance to make the right choice, that's what matters. People should be given a chance to do what's best for themselves, not what's best for their surgeon or the hospital. Anyway, it's late in the day and I'm getting to be a crotchety old man. Right, Luis?
I think you're doing fine.
Come on, you are not old.
Luis, I'm not old, but I am crotchety. I just don't have the excuse of being old. All right, we're pretty much almost done. A little bit more here. Oh, yeah. Look at that. He's coughing and it's pushing that thing out. All right, any questions, Henry?
Yes, this we have a comment and a question. For the question, this comes from Rudy on YouTube, and they ask, "How come United Healthcare doesn't cover?"
What?
They asked, yeah, how come United Healthcare doesn't cover?
Doesn't cover?
Yes.
This surgery? Yeah, United Healthcare has covered the surgery. We've had United Healthcare pay for the surgery. We've had Blue Cross pay. We've had Cigna pay. We've had 47 insurance companies pay to date in the last 3 years. But what we don't have is a contract with United Healthcare. So without a contract, we can do your surgery and United Healthcare could pay us zero. And there's nothing we can do about it. We can sue them, but we'd have to spend $100,000 or $1 million. 100,000 is cheap. We'd have to spend $1 million to get our $50,000 from them. And they know that. That's why they do it that way. They write the rules so that when they screw a doctor or a surgery center over and don't pay them, or a hospital, they know that we have to sue them. That's our only way to get the money. And suing an insurance company will cost us $1 million per claim. The only way to do it is to get a bunch of them, put them all together and do what's called a class action lawsuit. And to get a lawyer who will actually do that on contingency, meaning that they don't take money from me, they take it only if we win. And the insurance company has to pay the lawyer bill. Well, the insurance companies wrote the law so they don't have to pay the lawyer bill. So they know the only way I can get paid for your surgery when they deny it is for me to spend $1 million suing them just to get $50,000. Does that make any sense? Would you spend $1 million to get $50,000? No. So if you want to know why United doesn't pay for it all the time, it's because you. Who's the person who asked? Who's the person who asked? Henry, your question. Who is the person that asked the question? Am I missing? Why is Henry not answering?
I so apologize. I was getting water. My bad.
Oh.
Yeah. My
Who
apologies.
is the person asking?
Rudy Gerdes.
Ruby?
Rudy.
Rudy.
Correct.
Rudy, the reason United Healthcare doesn't pay is because of you. You don't make them pay. You're the one who has a contract with them, Rudy. Why are you asking me why they don't pay if it's you they're supposed to be paying for? The reason is because you're not making them pay. That's why. I can't make them pay. I don't have a contract with them. So the only person that can make them pay is you, Rudy. People like you. You all want us to do everything for you. You got to get up and do some of it yourself. Okay? Don't be so lazy. You want your insurance to pay for your medical care? Go fight your insurance company and make them pay. It's not my job to get your insurance company to pay. It's your job. I love it when people blame me for, oh, by the way, thanks for discovering the cure to back pain. And, oh, why aren't you getting my insurance company to pay? Why aren't you getting your insurance company to pay? It's your insurance. That's crazy, right? That's like somebody going to a restaurant with their little children, and the children are running around, and they're yelling at the waiter saying, why aren't you getting my children to stop running around? Well, why aren't you getting your children to stop? You're their parents. You need to get your kids to stop running around. Don't talk to the restaurant owner and say, why aren't you getting my kids to stop running around? That's your job, parent. Rudy, it's your job to get your insurance company to pay for your stuff. Maybe you shouldn't have bought such a shitty insurance. But to be honest with you, what you should be doing is fighting your insurance company, sending letters, and more importantly, getting the government to change the law so that insurance companies cannot say no and deny medical care that you need. Okay? That's really what you should be doing. Yeah, so that's why, Rudy. You want to know why insurance companies don't pay? Because they don't have to, because you're not making them. That's why. If you made them pay, then they would pay. Oh, yeah. Bring it in. All right, so we're going to do this and then the left DPR. Which levels are DPR? So pretty much the same levels, but the other side. All right. Any other questions?
Yes. So, this next one is a comment. Comes from Kelly on YouTube.
Yep.
And they said, looks and sounds like my horror story. I'm currently waiting to be approved to come see Dr. Deuk. Makes me sick what my surgeon did to me. Thank God my friend told me about Dr. Deuk.
Yeah, you're welcome. I'm trying to get the word out before more people have bad surgery, you know? It's not about me, folks. It's about you. You guys are victims of this system that is literally using your insurance policies to make a lot of money they shouldn't be making and putting you at massive risk with all these highly invasive surgeries that are dangerous and that have complications. I'm just trying to make you guys aware of it, okay? And if you want me to fix you, I'll fix you, okay? But I can't fix your insurance companies. And people who want to know why their insurance won't pay for this, you need to talk to your insurance company and ask them why. Okay, that's between you and them. I always get the insurance question, and I always put it back on people. Is it my job as a neurosurgeon to get the insurance company to pay for the surgery that will fix your back? Hell no. It's your job. All right. Any other questions?
Yes, this next question comes from Rudy, once more on YouTube.
Yep.
And they asked, I think you just answered the question, how do I make them pay?
Well, Rudy, the real way you make them pay, there's two things, okay? Number one, you've got to get the law to change. I don't know where you live, but in Florida, the insurance companies spend millions of dollars every year bribing politicians to basically make laws that let them not pay the bill and not be accountable. We need to change the law. The law needs to say, if the doctor says you need the surgery and you feel you need it, the insurance company doesn't want to pay for it, then it goes in front of a committee. And in the committee, you have doctors who are not being bribed by the insurance company to say no, and regular everyday people. And they get to hear, okay, on one side you have Dr. Deuk Majan and the Deuk Laser Disc Repair and peer-reviewed publications, FDA approval. And on the other side you have the insurance company saying we don't want to pay because everybody's going to want this surgery, and then we're not going to have as many billions of dollars a year in profit. You know, United Healthcare, they make $5 billion a quarter. Every 3 months, they make $5 billion profit by denying treatments, just like this. So you want to know why they're denying? They're denying it so they can make more profit. Because every one of these they pay for, they are losing that much profit. So if this is a $100,000 surgery and they have to pay for 10 of them, they're losing $1 million in profit. Period. Because if they didn't have to pay for it, which they don't pay for it now, most of the time, then they get to keep that money. And that goes into their profit. Okay? They're a business. They want profit. They don't care about you. They don't care about you or any of their other beneficiaries. All they care about is how much money and profit they're going to make. And they are the richest, most powerful insurance company in the world. They made $5.5 billion every 3 months in profit. And that's possible because they deny people's treatment, people like you. Okay? And they're going to keep doing it until you hold them accountable. The only way you're going to hold them accountable is A, by suing them, which that's what we're going to be doing soon. Look at this herniation. Here it comes, Henry. Ooh, badingo. Look at that, Henry. Look at that thing.
Yes, sir.
That's a biggie. That is a behemoth. Not as big as the one I took out a couple of weeks ago. I think she still has the record. Remember that thing? It was 3.5 centimeters.
Of course, yeah.
Yeah, it was 3.5 centimeters. This one is 2 centimeters. Okay, you guys see it?
Yes, we do.
So, getting back to the insurance. Number one, sue them to get them to pay. Okay? Sue them with a bunch of other people that want to sue them as well. Number two, get your politicians to change the law so that the insurance companies cannot say no and not pay for medical care. If they don't want to pay for it, then it has to go to a committee made up of doctors and citizens, regular everyday people, like a jury, and they have to decide, should this, be covered by the insurance or not. If we did that, lo and behold, miracle of miracles, the insurance companies would start behaving. Because right now there's zero accountability. No one is holding them accountable. No one. They're denying all they want, and no one is stopping them. Nobody. It's like a neighborhood thief just goes house to house robbing people. Move. And nobody does anything about it. They just keep letting them go every night, and the thief is walking on the street. Every night, just walking down the street, going to the next house. And nobody does anything. You all look out your window, you see the thief, you say, hey, there's the thief. I wonder whose house he's going to rob tonight. Let's watch and see. So, whose fault is it? It's your fault for allowing your insurance company to rob you people. Okay? That's what's really happening. They're robbing you. And who should be protecting you? Your politicians. But they're not, because they're all bribed. They've all been bought off. Somebody told me once a statistic that's amazing. Look at that. There's the inflammation right there. You see the pink stuff? That is the inflammatory tissue causing all the back pain. So, someone told me once that the tobacco industry spends $50 million every year to lobby the politicians. That's basically to bribe the politicians to pass the bills and legislation to allow the tobacco companies to keep selling, cigarettes, which we know are causing cancer asthma, emphysema, COPD, and killing people. We are literally allowing a company to sell something that we know kills people, okay? And our government doesn't do anything about it. And it should be, by the way. It should do something about it. Should stop that. So the tobacco companies spend $50 million a year for the ability to kill Americans. I mean, I'm talking millions of Americans. Not just kill them, but make them torture them. Like, have you ever had COPD? You ever know anybody with COPD? Yeah, they're tortured. These people can't live. They just can't do anything, because as soon as they start exerting themselves, their respiratory system shuts down, and all due to tobacco, cigarettes. Okay, so for $50 million in lobbying, buying steak dinners for our politicians, supporting their campaigns, you get to kill people, lots of people. That's what the tobacco industry does. What do you think the insurance industry spends? They don't spend $50 million a year. They spend $500 million a year in DC lobbying. Now, why? Because the politicians write laws that allow the insurance companies not to pay for medical care that's needed. What is the number one reason in the United States for bankruptcy? Unpaid medical bills. People basically go get medical care, and they don't get the bill paid by the insurance. The insurance denies it, and then the person's stuck with the bill, and then they have to claim bankruptcy to get out of paying the bill to the hospital. Well, that bill should be paid by the insurance companies, not the person, not the patient. Okay? People shouldn't be claiming bankruptcy to get away from paying medical bills. So that's the problem, my friend. You have to fight the insurance companies by getting the politicians to write laws that do not let the insurance companies not pay for your medical care, because that's where we are right now. And in the meantime, sue them. Go pay for your Deuk laser disc repair. Pay cash. And then we will sue United Healthcare together to get them to pay the bill. We may not win, and we may win. But if we win, it will change everything for everyone in the future. Because they only want one loss. That's all they can take. If you can take Goliath down once, then Goliath will never get back up again. They will literally start covering the surgery left and right for everybody. But it takes that kind of an action. And I can't do it alone. I need you guys to help. We're done. Yeah. Good. Yeah. We're done. I need about 30 seconds. And then we'll move on to the DPR. Good stuff. But I'll tell you this. The politicians, they distract you with all kinds of things, getting you guys to pay attention to things that aren't even important, instead of the important issues like your health care. How often is health care on the agenda for politicians to talk about? Huh? You've all been watching the presidential debates, right? They've got you all distracted on stupid things that don't even matter, when the real issue is your health and well-being, your job security, your ability to live, make a living, survive, and not spend all your money on health care. Okay? And they're taking all the money out of health care, these insurance companies, leaving you and the providers with nothing. Hospitals are going bankrupt left and right. Left and right hospitals are going bankrupt. They're not making enough money. Stewart Healthcare, it's right here in Melbourne, Florida. They are on the verge of bankruptcy. It's a big company, a big hospital system. Grabber. They haven't been paying their bills for about a year now. They're about to file bankruptcy. Folks, your hospitals are closing down across the country. Where are you going to go when you're dying? And this is what the insurance companies want. They want your hospitals closed. They don't want you to get expensive health care. They don't want you to have emergency care. Emergency care costs them a lot. And you guys are sitting there just totally oblivious to it all. And it's just incredible to me, you know, that you guys aren't more aware of what's happening. I'm happy to tell you. Somebody has to. All right. Henry, what questions you got?
No current questions, but we do have a comment from Sean on Facebook
Yep.
saying, "Wow, a doctor that's that's honest, straight up. I have degenerative disc disease for about 30 years."
Well, Sean, we can fix you. We can take your pain away. We're never going to make your disc look pretty, but we will fix it so it doesn't hurt you anymore. Do our free MRI review. It's free. Literally free. I spend 2 days a week doing free things for people. I don't get paid a dime. All day I do free MRI reviews for people. Like you, Sean. I don't ask for anything in return. Just a little respect. A little appreciation. That's all. You know, all the hundreds of MRI reviews I've done. You know how many people go and write a Google review saying, "What a great place, Deuk Spine, helping me out, giving me a diagnosis nobody else gave me." Nobody does it. You know, that's where we are today, unfortunately. I don't ask for it, but that's all. You know, it'd be nice if somebody actually showed some appreciation for what we do for everybody. All this stuff we do, broadcasting, Henry, who's broadcasting right now, this equipment, I pay for it all out of my pocket. Okay? And it's all things that I don't get any money for. What? No, we're done. I mean, you already spiked it?
Yeah,
That's fine.
I apologize.
No, it's all right. You did the right thing. Anyway, we're done. Let me just check one more time. Looks good, folks. There it is. So that's the tear where the herniation was. This is outside the disc. I'm looking at it. And sometimes you look at that tear, it's only like a millimeter wide. Yeah, we're done. I just want to show. See this glass fiber right here? That's the laser fiber. That's 1 millimeter. So this tear right now is like probably around 3 millimeters, but sometimes it's down to 1. This one is 3, but looks good. Very happy. He's going to do great. So this should fix his right leg symptoms as well as his back pain. No metal, no screws. No company is making $50,000 on implants for this surgery. We're not putting a single unnatural thing in this patient. Okay? Or at least we're not leaving. We're putting metal right now, but it's coming out. This is the only surgery that you can do to fix your disc problem without some kind of plastic, metal, or cadaver thing going in. All right, done. We fixed 2 discs, L2-3, L3-4. Now we're going to do his facets on the opposite side. Look at this incision, guys and gals. Tiny, right? No, we don't need it. All right, I'm going to do it from there. No, I got to come over there and do it. Let me just come over there. Go ahead, Jordan. So I'm going to switch sides. Keep the questions coming. We got about 5 minutes left, and we'll be done. But basically, we're going in and we're going to kill the pain nerve to these joints, okay? The first joint is going to be the L2-3 on the left shot. See that tip of my needle right there, guys and gals? Shot. It's right on the transverse process, just at the bottom right there. Shot. All right, you see where the tip of my needle is? Not the numbing needle. That's good. All right, look at that. Joe, show him, Jordan. Yeah. Well, now I went a little south, but right there. Shot. Where that tip is, that's actually where the white arrow is. Jordan's even a little better. That's our target. There's a pain nerve there. It lives there. It's called the medial branch of the dorsal ramus. And that's what the nerve that brings all the pain. Hold on. that comes from the facet joints. We're going to go deaden that nerve. By deadening the pain nerve, that'll take his facet joint pain away. Now remember, we already fixed his disc. Now we're going to fix his facets. Shot. Damn, look at that, Luis. Bam. Bam. Shot. That's perfect, right where it is. I'm on the bone. I literally can feel the bone. It's perfect. Very happy with that. Shot. Doesn't get any better than that. That's one down. By the way, we did one of these on Tuesday. Shot. And the guy that we did, he was like zero pain the next day. He was so happy. They shot that patient, and his wife came, oh, where are they from? New Hampshire. Yeah, New Hampshire. You have a good memory. They came from New Hampshire, and he had the DLDR shot. Go ahead, Luis, fix it. And right after the DLDR, he had facet pain. Well, actually, he had it ahead of time. We knew it. We told him, but he didn't want to get it fixed. I said, you're still going to have a lot of pain if you don't get that fixed. And sure enough, the next day he did. So we got him fixed, and we did this procedure that you're watching, Shot. I got to be able to see a little bit further south. And his pain was 100% gone. Shot. Shot. I think I'm close, but no cigar. Very close. Right about there. A lot of scar tissue here. I can feel the metal, the screws. I'm literally touching them. Shot. You see the rod right there? Yeah. A lot of scar tissue. Shot. I got to be just totally dead on. Shot. I think that's it right there. I don't know. Shot. I want to make sure I get this. It's really hard to tell. I think that's it. Hold on. Shot. Yeah, oh no. The reason is we got all that metal. Shot. Yeah, that should be it right there. I need 30 seconds. I'm hoping that's it. Normally I hop around on this little bone down here, but unfortunately with this patient, he's got all that hardware, right, from his prior surgery. Great job, everybody. So pull the fluoro out. Take a look here, Henry. We did the DLDR, 7 millimeters, 8 millimeters, and then we did the DPR on the left. It's just a 4 millimeter incision. All done. Write up your questions. I'll come answer them for you. Good work, everybody. Hopefully that does the trick.
I'm here with a patient of mine who traveled all the way from South Carolina to come to the Deuk Spine Institute. She's a healthcare provider herself. She's had some back issues. She had the Deuk laser disc repair yesterday, and she wants to share some of her experience with you. Tell us about your back pain and your leg pain before your surgery yesterday.
I had surgery on L4, L5, L5S1, so my symptoms were classic. I had the sciatic pain that ran down my leg. Every once in a while my foot would go numb if it was pretty irritated. And then I had pain along the top side of my hip. So pretty normal type stuff. I was going to the chiropractor, I was getting massage therapy, I was starting on meds once I did imaging and made sure that this was actually a herniation and not just like a muscle pull or something. So I had kind of gone through all the things. Had back surgery in 2020 at another institute, and they did a microdiscectomy / laminectomy of L4, L5. I was good for maybe 2 years, almost 2.5. Before it re-herniated. So not the most fun in the world, because you expect whenever you go to have a procedure that it's fixed and your life will be ongoingly better. But I'm a nurse and I ride horses, so I'm pretty mobile all the time, and that kind of pain just really gets you down.
So why did you travel from South Carolina to Deuk Spine? What do we offer here that you couldn't find there?
I was on the great internet search, to find out more information. So to read more about spine surgeries, about how many times people relapse, like what's involved. I surely didn't want to go up to a fusion because that's absolutely ridiculous. So I happened to find one of your videos on YouTube. You offered the laser therapy. I was just sold almost as soon as I saw it, because it made sense to me.
Yeah, having the perspective of being a nurse and a healthcare provider, it makes sense. You're fixing the problem, debriding the disc tear, allowing it to heal naturally into a pain-free state. You had your surgery just yesterday.
Just yesterday.
Not even 24 hours ago. Were you in the hospital for your surgery? I
was here in your surgery site. I got here around 1 o'clock-ish. Did all my pre-op stuff, rolled in probably around 1:35. I think our procedure lasted not quite an hour. I was out and eating dinner with my dad at 5 o'clock at a restaurant that your anesthesiologist recommended.
Oh, good.
Dr. B, he's great.
So no hospitalization.
No.
No morphine pump after surgery because you're in so much pain from
Not
the
at all.
surgery. No narcotic painkillers after surgery, right?
No.
What did you take for pain that we gave you? What new medicine did you take after surgery?
So I haven't taken any new medicine after surgery. I was on Robaxin and gabapentin prior to. Of course, I have to wean off gabapentin, so I did take my gabapentin this morning, but I didn't wake up in any pain. But unfortunately, that med you have to wean off of, so it's not like I can stop it to cold turkey.
Yeah, so basically we did a small incision. We went in with the laser and debrided your tear. And at the end, we had a tiny 7-8 millimeter incision. And there's really no pain after the surgery, so there's no need for narcotics. After your prior microdiscectomy, you probably needed to take some Percocets or oxycodone.
Just to roll out of bed, just to get up off the couch after that surgery.
It's painful.
It's painful. Yeah. It's absolutely painful.
And the difference, people ask me, what's the difference between Deuk laser disc repair and a microdiscectomy? The difference is a microdiscectomy goes straight into your spine. The surgeon has to pull all the muscles off your spine. Then they have to drill a hole in the bone to get to the disc. And they have to remove ligaments, and they have to take your facet joint partially out. There's so much destruction that goes on under the skin. The surgeons don't talk to the patients about it because
no, they didn't.
Everybody does it. They think there's no better way, but there is a better way. It was developed by an Iranian orthopedic surgeon to come from the side. And I'm a student of one of his students, so second generation endoscopic surgeon, transforaminal. And it's a better surgery because it doesn't cause any damage to your spine or your body. It's wonderful.
It is wonderful, I'd have to say.
And how do you feel today? Is your preoperative pain gone?
Oh yes, all of that's gone. The only thing that I feel is right in mid-spine where you basically stab me. And that's,
Yeah, you know about that. You watched the videos. So,
brought a tear to my eye there for one little second.
I see.
I forgive you.
Thank you. Thank you. Well, I'm glad you're doing well. Is there anything you want to say to your fans and friends out there?
Oh, Henry, what did you do? All right, we sped up our testimonial process, and I'm here. I surprised Henry. I came back early. So surgery went very well for this patient. As you could see, somebody put a lot of hardware, a lot of money, cha-ching, cha-ching, cha-ching. Surgeons making money, companies that sell screws and rods making lots of money, hospitals making money, even the insurance companies making money. Who's suffering and who gets the short end of the stick? The patient. This patient had a surgery through the belly, surgery through the back, screws and cages, and then screws and rods. Before that, I'm sure he had lots of other stuff done. And this is the state of things right now in America with patients with back pain. They're not being treated for a cure, they're being treated for money. Basically pure and simple. And the doctors don't want them out of pain. The doctors want them to stay in pain. We want our patients out of pain. We're different at Deuk Spine. That's our philosophy. We want people to come here, get fixed, and we don't want to see them again, except, you know, maybe if they want to bring a cake and cookies by. So it's a very different philosophy. We believe pain can be cured. We know it can be cured. We've seen it cured millions of times. And other doctors don't believe it can be cured, so they're not going to cure it. Yes, Dr. Patel.
Make done surgeries?
Yeah, why?
I'm ordering a couple of x-rays, so see if the Jordan is coming out.
Yeah. Let me show you Dr. Patel. Here's Dr. Patel, the Dr. Patel you hear about all the time. It's too dark, come closer.
Yeah, it's contrast.
This is Dr. Patel. He basically started Deuk Spine with me, and he's been here for how many years now?
17?
17 years. You haven't aged one bit. So he and I, we do magical things together. Thank you, Dr. Patel.
Thank you.
All right, Henry, let's take our first question.
Alrighty. First question is coming from Sean, once more on Facebook,
Sean?
asking, does degenerative disease cause you to lose height? My legs sometimes lets go.
Yeah.
And I have to grab something, keep myself from falling. I have pain sometimes also in my butt cheek.
All right, so Sean, first of all, degenerative disc disease is a collapse of the disc. Yes, you lose height, for sure. Second of all, does it cause you to have pain in your legs or weakness in your legs? No, it does not. Stenosis does. Spinal stenosis will pinch nerves and cause that. We can fix that for you. And then third of all, you have pain in your butt cheek. That's probably piriformis syndrome. Look it up. Piriformis. We can now fix that too with 4mm incision. If you just saw the end of this surgery, there was a 7mm incision on the right and then a tiny 4mm incision on the left. We do the same size incision. We can fix your piriformis permanently.
And then this next question comes from Philip on YouTube,
Philip?
asking, Dr. Deuk, can you please comment on the difference between a orthopedic spine surgeon and a neurosurgeon, and
Yeah.
how one should choose? Thank you, sir.
Well, Philip, first of all, there's 3 choices you have, okay? There's orthopedic surgeon, neurosurgeon, and Deuk Spine Institute. That's really the 3 choices. I'm serious. I would not go to the orthopedic surgeon. I would not go to the neurosurgeon. I would go to Deuk Spine. Why? Because what we're doing here is so far advanced above it, what everybody else is doing, that literally if you go anywhere else, you're going to end up getting like this patient, right? All these screws and rods and nonsense you don't need. So, but just if you want me to comment on ortho versus neuro, okay? Neurosurgeons are trained for 7 years during residency every day dealing with spine stuff. Orthopedic surgeons are not. Most orthopedic surgeons just do knees, hips, shoulders, kind of orthopedic stuff, not spines. And then if they want to do spine, they go do 1 year of training in spine. So as a generalization, but not always true, neurosurgeons are generally better trained in spine stuff than orthopedics. Second, when it comes to pinched nerves or pinched spinal cord, that's what neurosurgeons are trained to treat, unpinched nerves and spinal cord. Orthopedics really aren't. So I wouldn't go to one for that reason as well. But I will say this, I have met about 5 orthopedic surgeons in the last 26 years, 5 that are amazing, and they know more than neurosurgeons. They're better than neurosurgeons in general. They're not better than me, but they're better than most neurosurgeons. And these guys and gals are amazing. So it really depends on the individual, right? Like, I wasn't even supposed to be a spine surgeon. I was supposed to be a brain surgeon. And I was supposed to do children's brains, brain tumors. I was supposed to be the next Ben Carson, okay? Obviously I'm not, because plans change. I somehow ended up here in spine and pioneering spine surgery. Not what I expected. But that was in God's plan for me, so that's why I'm here. Long story short, don't just pick neurosurgeon, orthopedic. Look at the problem. Is it a pinched nerve? I would do a neurosurgeon, okay? Hands down. But I would also go to Deuk Spine. That way you get the very best state-of-the-art care that is safe. We don't have many complications at all.
That is it for questions.
Had a great time with you all today. Thanks. I really appreciate the engagement from the audience. I love the question and answers, and it's great to hear some new names are here. We're broadcasting every week. Today is Thursday.
Yep.
So we'll be back next week for some more action and fun. Bring your questions with you. Just don't ask me why your insurance company doesn't cover our treatments, okay? That's on you.